So some of the nurses, international nurses, some of the hardest parts about preparing for the NCLEX as an international nurse is that we realize that being a good nurse does not automatically mean you will pass the NCLEX very, very fast or very, very quickly. And yes, many highly experienced nurses struggle, not because they lack the knowledge, but because they approach NCLEX the wrong way. And we talk about different things that probably is preventing you. And sometimes the mistakes are just small, but they cause months of delay. And so if you're preparing for your NCLEX, I just want you to know that, yes, mistakes do happen, and a lot of international nurses, they go through this. So I'm just going to walk you through the biggest mistakes that a lot of us as international nurses make, so you can avoid them from early, and you can actually study smarter to be successful on your exam. So studying in nursing school is going to be totally different for your NCLEX. The first big mistake is that studying the way many of us study back in home. We memorize notes, we study diseases and definition. NCLEX is totally different, and it's not asking you what fact do you know, it's asking you what's safest. And that's just it. What is the safest nursing action right now? And that's all NCLEX is all about when you're going to the exam. Using too many resources, as we say, you don't want to be stacking up on that. That is one of the common reasons. You're buying too many resources because you just want to feel like the smart nurse. No. 1 week, just get UWorld. Next week, get Archer. The next, you get a ton of PDF notes, videos. That's just like too many resources. You're creating mental overload. You don't want that. So just choose one bank, one question bank, one content source, stick with it, and focus on studying from there. Focus on scores instead of rationals. We don't want you to be doing that. Some persons tend to be panicking when the scores are low and not realizing that you're still a strong nurse because you probably are doing well either way. But it's just that your scores are not so good. So you want to review why your answers are wrong. Look at your rationals and train your brain to answer the questions properly based off your rationale. Priority. You ignore the priority questions. You don't want to do that because priority is one of the biggest areas where international nurses are struggling. Ask yourself, who is unstable? Why are they unstable? And use the airway breathing circulation method to answer your question. A patient with airway compromise comes before almost every other patient or anything else. We tend to fear the select all that apply questions, the SATA questions, yes. Many nurses fear them, not only the international nurses, but yes. We fear them and we start guessing emotionally. But each option stands alone, so just treat them as the true or false. So answer each question, true, false. That's it. Trying to memorize every drug, you don't need to do that for every medication. Do not do that. Instead, learn the drugs by their endings, their major side effects, and priority nursing concerns. Do them by their drug class. You understand? Studying without consistency, that is going to be very, very hard. Studying hard for 1 day and stopping for 3 days is going to slow your progress. So as we say, even 40, 50 focus questions daily, it's going to build you stronger, in terms of when you're thinking. And comparing yourself with others, a lot of times we tend to do that. One nurse studies for 2 months, another studies for 6 months. Do not do that. Comparison creates unnecessary pressure, and we don't want to do that in a time when you really need to be focused. Letting anxiety control you on exam day. Many nurses know enough to pass, but when it comes on to panic, it changes their overall performance. The day before exam, I will always tell people, rest. Trust what you built. Whatever you never know before, you just don't know it. So just go in and just, get enough sleep, eat, and just go in with, you being prepared. So if you're preparing for your NCLEX, go ahead and just comment down below which mistake do you think affects nurses the most, and see how we can actually try to help or improve on that. Remember to go ahead and subscribe to the ThinkNursing page here at where we talk a lot about nursing. Most importantly, give the video a thumbs up, a like, and a share, and just comment for me, please. Just say something nice about the video, so the algorithm can know that you're interacting, and just to get more persons over here while you are also going to share it with somebody else. Until then, I'll see you in the next video. Bye.